The American Cancer Society estimates that this year more than 22,000 new cases of ovarian cancer will be diagnosed. It is one of the most deadly of women's cancers, and many don't realize they have it until it has already begun to spread. So Dr. Scott Ackerman is one of the First Coast's leading oncologists. He's here today to talk about the importance of early detection and what symptoms you need to be looking out for and why it's so important to go in and get checked. And that leads to my first question, because, you know, women will go in and get mammograms and they'll check to see if they have breast cancer, but what about ovarian cancer? What are the screenings that need to be done to see if you have it and try to prevent it before it spreads?
It's a great question, Casey. The problem is we don't have a good screening method, and we don't have good screening guidelines for ovarian cancer. It's a real challenge. There's no good early detection method, no effective screening method, and there's a problem. There's, as you said, 22,000 women will be diagnosed with ovarian cancer this year, and more than half will die because it's frequently diagnosed in a late stage. The current screening for ovarian cancer, if you want to call it that, is when women go in for their pap smear, their well woman exam annually. You have a pap smear, and during that time, the gynecologist will also do a pelvic examination by manual, using both hands to examine and feel for any masses in the abdomen. Truth is, that's the best we have right now for ovarian cancer, and it's not very effective. We do know there's a blood test called the CA-125, which is elevated in many women with ovarian cancer, not all. It was thought at one time, there was a push at one time to use that as a screening method, but that alone has not been a good screening method. There's two nice studies going on right now, large studies, and they're showing some promising results regarding ovarian cancer screening. And that is combining the CA-125 with an ultrasound. So doing the two together. So you go in for before you go see the gynecologist, you have your CA-125 drawn, and then when you're there for your pelvic examination, he or she does an ultrasound at the same time to look for a mass in the ovary. And then if you correlate those two studies together, you can identify women that may have ovarian cancer early. This is showing promising results, but more research it needs to be done. So I recommend to patients who ask me to continue with the well woman visit.
Yeah. Once a year?
Once a year, right? And you should see your gynecologist once a year for a pelvic examination, pap smear, and look for the symptoms. So let's do that and look for the symptoms that might be associated with ovarian cancer.
Well, and that leads me then perfectly into the next question, and that is, what should we be looking out for? What kind of symptoms, if we're feeling or someone's watching at home has this, that would indicate that we might have this? Are they pronounced? Are they subtle?
Yeah, no, they're vague. They're vague symptoms, and they're symptoms that a lot of women have all the time anyway, or men too for some of these symptoms. Bloating could be a symptom of ovarian cancer. Pelvic pain, urinary problems, frequency of urination, irritable urination, difficulty with eating, and that you feel full quickly. These are all symptoms of ovarian cancer, but unfortunately, these are symptoms of ovarian cancer that's probably diagnosed in a later stage, because once the tumor is big enough to cause these problems, it's usually in a later stage. So if you have these symptoms, make sure you see your physician and talk to him or her about these symptoms if they persist.
Right, it better be safe than sorry. Are there ways to lower the risk of getting ovarian cancer? Are there things that I might be doing right now that I don't know that could be leading to an increased risk of getting it?
Well, there's some things that you can do. There's some factors that can reduce your risk, but there's other factors that you just can't avoid. I've spoken before with you about hereditary breast and ovarian cancer syndrome, the so-called BRCA gene. We always talk about the BRCA gene, and we talk about that related to breast cancer. But the BRCA gene is related to hereditary breast and ovarian cancer syndrome. So people that are BRCA positive, so women with breast cancer, many of them we evaluate for having the BRCA gene, and if they are, we talk about the risk of second cancer in the other breast, but they're also at a very increased risk for ovarian cancer as well. So if you have a family history of breast cancer or ovarian cancer and your mother or aunt had it at a young age, you may have that BRCA gene, and so you should see your physician about having the BRCA testing for that. So you can't avoid that, but it certainly helps you know if you're have a higher propensity to get ovarian cancer, and it'll make you more you'll see a physician more often, and you'll be more alert to the symptoms. But other factors that could reduce your risk of having ovarian cancer is to have children. If you have children, women who've had children have a lower risk of ovarian cancer. Women who've used oral contraceptives have a lower risk of ovarian cancer. We think because there's less ovulation, and that diminished ovulation may have a protective effect on the ovaries. Women with their ovaries removed for whatever reason obviously have a lower incidence, but don't think they have no risk of ovarian cancer. Even if the ovaries are removed, there's still a risk of ovarian cancer because some of the tissue from the ovaries may be left behind. Also, obese women are at a higher risk for ovarian cancer and other cancers as well. So we recommend a low-fat diet and those things that will help keep your body mass index proper.
If there's somebody who's watching who might be suffering or is being treated for ovarian cancer, there's an event that's coming up?
Yeah, remember a few weeks ago, a few months ago now, we had Dr. Buckley on the show with me. He's a gynecologic oncologist. He is sponsoring an event to support women with ovarian cancer. They get to meet other women who are facing the same disease. They can share experiences and find ways to cope with their illness. It's next Friday from 11 to 3. And it's open to any women with ovarian cancer. There'll be lunch there, some massages and manicures as well. Yeah. It should be a nice event.
And just for people at home to keep that graphic up just for a second because, or you can take it down. But there was a number to RSVP at the bottom was Carolyn. The number, if you want to write this down, is 493-3605. So make sure you RSVP to Carolyn if you would like to attend that event. And Dr. Ackerman, thank you as always for being here and giving us your insight and perspective and sponsoring the segment. And for questions regarding today's topic or any other health questions that you might have, you can connect with Dr. Ackerman on Facebook by visiting facebook.com/First Coast Oncology.